I'm Keisha and this is my Narcan video. So I have to administer Narcan because my patient has had morphine and their respirations are below 8. So I'm going to check my doctor's orders and see that Narcan has been ordered, and it has. I'm going to check my IV monograph to see what I dilute it with, and I'm going to dilute it with normal saline, 1 milligram of medication, and 1 milliliter of medication, 9 milliliters of normal saline. And I'm going to give it over 30 seconds. And so then I'm just going to check that it's stable in normal saline, because the client has a running IV of normal saline, and it is. And I'm going to check the adverse effects to know what I'm monitoring my patient for after. So I'm also checking that it's on her. Oh shoot, I don't have a pen. Maybe there's one at the. I'm just going to go over to this med cart and look for a pen. Oh, here's one. Okay, so I have a pen now. I'm going to, I'm checking that it's on the MR. I'm doing my math to show that I've calculated that with her dose that's ordered of 0.1, that I need to be giving 2.5 milliliters. And so that's 1 milliliter of med, 9 normal saline for a total of 10, wastes 7.5 because I'm going to give 2.5 once it's diluted. So I'm going to perform hand hygiene, and I'm going to take the medication out of my Omnicell and do my first set of checks. So right patient, Sue Brown, right drug, naloxone, right dose, 0.1 milligram, which is going to be diluted into 2.5 milliliters. Right reason is for low respirations. Right route is IV. Right time is whenever she needs it, and right documentation that it's on my MAR. Okay, perfect. So now that I've done that, I can open up an alcohol wipe and clean the top of my vial for 30 seconds. Then I'm going to open up a brand new needle and open up a brand new 10 ml syringe so I can draw it up. I'm connecting them, not touching this, in order to maintain sterility. I'm going to do a uncap and draw up 1 milliliter of air. Inject into here the air. Then draw up 1 milliliter of medication. Get the air out of it. Okay, then show my camera that it's 1 ml. It's dark in here. Oh, there we go. Now it's 1 ml. Turning the lights on would be helpful in this hospital. Oh, it's like leaking. Oh, you know what? It's pushing back on me. That's why I'm not getting the right dose. So it's pushing back on me. There's too much pressure in this vial, so I'm going to hold the plunger while I make sure. Look, it's like leaking everywhere. Okay, apparently there's too much air in this vial. I'm going to recap this. Maybe use this alcohol wipe to get some of this green stuff off me. And there we go. Okay. So now I'm going to open up my thingamajigger. What's it called again? Fluid dispensing connector. I'm going to get a brand new, still in the package, normal saline. Take this off. I'm going to place this up like this to keep it sterile. Get the air out of it. And take the blue cap off. And I'm using like a no-touch technique to connect it. And then I'm going to do my second check on my medication because I have it drawn up. So second check, 7 rates. Okay, perfect. And now I'm going to and I'm going to double check my math with the second nurse. I'm I'm gonna take this off, I'm gonna throw it directly into the sharps. It's in the sharps now. And connect this using Clean Technique, and I'm gonna pull back so that I have 10 milliliters in here. So now I have my desired concentration. Okay, now I can take this connector off. I'm gonna make sure there's no air in here by getting this. There's a little air bubble at the bottom. Okay, there we go. Now I can push the air out. And now I need to waste. So I've got 10 milliliters in here, so you know it's the right concentration. And I'm gonna waste some into the appropriate container using a no-touch technique on my cap. There, now I'm gonna have another nurse sign the wastage. And now I have 2.5, which is what I'm going to administer to my client. Oh, before I put this down, I need to put a medication label on it. So I'm going over here, grabbing a medication label. So I'm gonna write on it what it is. Narcan. And now that I have this in my syringe, I'm gonna put this back in my Omnicell or wherever it has to go and do my third check of my medication. My 7 writes, and now I have what I need. So I'm gonna take my MAR in with me to the patient's room. So we'll pretend I don't have all this stuff. I just go in with my MAR, my medication, and a bunch of alcohol wipes. When I get into the patient's room, I'm going to introduce myself to the patient. I'm gonna check the band and compare it to the MAR, ask the patient their name, their date of birth. They might not answer me because their respirations are low and their sedation scale is too bad. And so if she can't answer me, it's gonna make it even more important to check her bracelet and check that I can see what her name and date of birth are and compare the MRN. I'm gonna ask her if she has any allergies. She can't tell me because she's passed out. That's why I'm giving her the drug. So I check her allergy band. She's allergic to tetracycline, and I'm not giving her tetracycline. So that's good. Now she has a running IV. Does she have a running IV? Wait a second. That should be attached, right? No, that's not attached. This is attached. Okay, she has a running IV, perfect. So I'm gonna clamp off her IV, stop her IV, put this here. I'm going to, did I do hand hygiene when I walked in the room? I'll just do it again just to be sure. Do hand hygiene. Now I know that the medication I'm giving is compatible with her running IV because I checked. And that's not running anymore, good. So I've cleaned that for 15 seconds. I opened this. I'm still using my no touch technique and I connect that on, oh, okay. So I let go of this, I touched my finger. If I did that in real life, I would go and I would redraw up the medication because I've broken sterility. But for the purpose of this video, let's pretend I did not break sterility. Okay, so I'm gonna connect this using a clean technique, a no-touch technique. And then this medication needs to go in over 30 seconds, so I'm watching the clock. And I'm slowly pushing it over 30 seconds. And I'm examining my client because Narcan often doesn't take very long to work. So we had a little bit of a debate about whether to flush this at the same rate and decided not to because the rate her IV is set at is 100 milliliters per hour, and 2.5 mils in 30 seconds is 300 milliliters per hour. So by restarting her IV, I'm sending that medication in at a slower rate than it's actually ordered on the IV monograph, so it is safe. Okay, so I've restarted her IV, make sure it's going at 100 milliliters an hour. I am watching my client, and I sign that I gave her this drug. And throwing this in the sharps. And yeah, then I just need to watch my client and make sure that the Narcan works, and if not, I can administer another dose. Okay, and yeah, that's it, cut.